Thank you, Avner. It's an honor and a pleasure to be here and to have this opportunity to engage with one of our most illustrious alumni of our International Masters of Public Health program, Dr. Josephine Ojiambo. I would like to take just a second to put into perspective the issue of equitable care access as it relates to the COVID pandemic. Today, we had the National Health Policy Conference of Israel, and the issue of equity was a central theme. Some of you may have seen the article today in the New York Times written by the U.S. Surgeon General Vivek Murthy and David Kessler, who is the Chief Science Officer for the U.S. COVID response team. And they were talking about the cutback of the federal funding for COVID that is anticipated later this year. And I just want to read very briefly one sentence when they're referring to the possible outcomes and of the cutbacks. Health disparities could worsen as life-saving tools move farther out of reach for the economically disadvantaged and communities of color, reversing important progress that has been made to narrow these gaps during the COVID-19 response. So when we are talking about equity, this is indeed a global issue. And someone who knows about global issues more than most people on this planet is Dr. Ojiambo. To start off, Josephine, will you say a few words about yourself, please, and your connection to Hebrew University, to Israel, and to the topic at hand?
Thank you very much, Yehuda. And I also want to, at the outset, say thanks to Avner and team for setting this event in place, putting us together this evening. So, distinguished listeners this evening, I want to first of all greet you in my Kenyan language, Jambo, and the answer is Jambo wherever you are. So I'm Josephine Ojiambo. I want to summarize a little bit about my own experience. I am currently an honorary lecturer at the College of Health Sciences at the University of Nairobi and an adjunct lecturer at the School of Public Health at a second public university called Kenyatta University. I, as you've heard, I'm an honorary president of the Commonwealth Business Women's Network Kenya. I have a few other titles. I am a member of the Rotary Movement, and I'm Rotary International's ambassador to UNICEF and to the UN system in Nairobi. But I want to dive straight into where Yehuda has left off. Very recently, since the COVID pandemic, I've served on the second tier of leadership in my country's Ministry of Health. And at this level, I worked with a group called the National Business Compact Coalition on COVID-19, advising our Minister of Health and Government on interventions to stem, control the COVID pandemic in our country. And on this committee, I brought business to the table with government to address what was essential for us. And that was actually water, sanitation, and hygiene in our initial response, and later vaccination. So beyond that, I'm an advocate of democracy, good governance, and sustainable development. I have founded my own organization that looks at the issues of young people, technology, and enterprise. But behind all of this, I'm a champion for global partnerships and their utility in addressing the SDGs. My particular area of interest is vulnerability, looking at refugee rights, gender equity, reproductive health and rights. And I also, as you have heard, I've been my country's ambassador to the United Nations and also served as the past Deputy Secretary General of the Commonwealth of Nations based out of London. Thank you for listening to me introduce myself. Thank you. Now I need to just say a little bit more before we go. I want to say that all of this has been possible because of the grounding that I got when I started out after my initial phase as a community doctor, a medical doctor in my country, with my experiences at grassroots level. This was made possible, my career, through my training, my Masters of Public Health at the Hebrew University of Jerusalem. And I want to say that we built there not just experiences, the skills, but friendships that have taken us forward. My friendship with the American Friends of the Hebrew University dates back to 2011, 11 years ago today, around this month, and has continued through the years. It's built itself into a friendship also with the British Friends of the Hebrew University, but all through that, Yehuda and team at the Brown School of Public Health have been constant advisors and supporters in my career. Thank you.
Josephine, I understand that today's program has already covered topics related to several of the SDGs. And from our perspective in public health, I think perhaps most relevant is SDG number 3, ensuring healthy lives and promoting well-being for all at all ages. And this is a broad, encompassing goal with many targets, including access to vaccines as relevant to what we mentioned regarding COVID, maternal health, HIV and other communicable diseases, traffic accidents, and so on. And you've worn many hats, as we've heard only just a few of them over your very illustrious career. Given your experiences and background, what are some of the most pressing issues that we need to solve in order to help move forward in achieving SDG number 3?
Thank you for that question, $1 million question. I think the needs for systems of care that are nimble, responsive, and adaptable to changing circumstances are very important in today's age. I look back on my experiences, particularly at the United Nations, and I remember the point in time in 2015 when we were launching the SDGs. The global community listened and watched as we enumerated them. And SDG, of course, number 3 on health was one of the most important to us from health policy. And for me, who's interested in vulnerability, SDG number 5. And just before that, we'd come over to Israel and spend some time in Haifa, looking at the issues of intersection between SDG 5 and 3 with ambassadors from the UN, from New York. But in 2015, when we were formulating these SDGs, no one expected the breakdown of the global community as a result of this particular COVID pandemic and the resultant shutdowns, the resultant economic impact it's had on millions of people around the globe, the disability, the deaths. And today we're facing a new challenge, the ongoing war in Ukraine. This has created new challenges of global proportions, the migration, the effects even in Africa, where we are seeing the rise in fuel costs and the attendant, increase in food and in food costs. And this is on the backdrop of an ongoing drought. So for us, the global scenario has changed a lot over just the last few years. All of this is going to test our health systems at all levels. It's therefore imperative that one of the things we must do is, first of all, restore the global order. It's fraying at the seams across the globe from the north to the south. We must return to true diplomacy and true development cooperation. And I just want to say that the program of public health from the Hebrew University and outreach of the Mashav is true development cooperation. But today we're seeing chaos around the world, brinkmanship, and no one is benefiting. But more importantly, this has serious consequences for the communities, especially in the global south. When we launched those SDGs, we all pledged to leave no one behind. Yet the discord we're seeing today in the leading nations of the world is only serving to overshadow and ignore the pressing needs of the poor. We need to revisit partnerships. Effective partnerships at all levels are critical. Partnerships that redress the felt needs. So the importance of upstream preventive care for the global south and for the whole globe cannot be overemphasized. Nearly all the challenges we face, and you've mentioned them, Yehuda, you've mentioned the issues of maternal health, HIV/AIDS, clean water, the spread of disease. All of these cannot be addressed except through preventive care. At least they cannot be tackled effectively. So SDG 3 on prevention is so important, in fact, more important than treatment. And the cost of providing prevention is remarkably lower and its benefits clearer, long-term and sustainable than those that are curative. Again, this is to say that our systems, our efforts, our resources must be directed towards prevention, to public health, to community interventions, and none other than the Hebrew University of Jerusalem is good at community-oriented primary healthcare. So we need to start now, and we need to revisit where we left off with prevention and target populations and have public health campaigns in place so that we are able to address where we've left out the most important, the most vulnerable. So I'll recap. We need to focus on building systems rather than knee-jerk reactions. We need to rebuild international trust and cooperation. We need to place greater emphasis on upstream preventive health. Thank you.
And as you, Josephine, wave your magic wand to make these happen, I wish you continued energies, insight, and wisdom. Yesterday, when I wanted to speak with Josephine, I was unable to because she was addressing the African Union about the safe reopening of schools in sub-Saharan Africa, and on it goes. Thank you very much for being my fireside chat partner this evening on the topic of equity and equitable access to care, which obviously we've only been able to just scratch the surface of. To the audience, thank you for listening.
Thank you very much, Yehuda, for being not just a mentor in school, but a mentor through life. And thank you very much, the Hebrew University.